Have you ever been curious about how one recovers from a brain injury? This is a very difficult topic. Today we are going to learn a lot about this topic from Dr. Sandeep Vaishnavi, who's an MD and a PhD. He recently wrote a book with Vani Rao, who's also an MD and a leading expert on extensive experiences helping patients recover from concussions and other brain injuries. The book is titled Healing the Traumatized Brain. This book goes about merging the fields of neurology and psychiatry, and it is clearly written for anyone who has dealt with a traumatic brain injury or caregivers. The book explains how the brain works, how injuries affect the brain, and how to use one's own power to recover. Dr. Vaishnavi and I discuss many issues dealing with brain injuries, ways to naturally heal, medication options, lifestyle changes, practical steps, and how to actually promote neuroplasticity in your life. Dr. Vaishnavi is well-spoken and down-to-earth. He's an excellent guest, and he does his best to break down these complicated concepts into something that almost anyone can learn about. I do believe you're going to enjoy this episode of the Intentional Clinician Podcast with me, your host, Paul Krauss. Before we get to the interview, let me tell you about Therapist Billing Services. Therapist Billing Services is a billing service for therapists that was created by therapists. Check us out at www.therapistbillingservicesllc.com. All right, let's get to the interview. Welcome to the podcast, Dr. Sandeep Vaishnavi MD PhD. It's really a great pleasure to have you on the podcast today.
Thank you so much. Glad to be here.
Excellent. We are going to be talking about a book that you have written with your colleague, Vani Rao, MD. It's called Healing the Traumatized Brain, Coping After Concussion and Other Brain Injuries. And also there's another subtitle, Helping with Mood, Memory, Behavior Changes, and More. Can you tell me, this was a book that you wrote as a follow-up to the original best-selling book, The Traumatized Brain. And I was curious, just as a first question, what inspired you to write these two books?
Yeah, I can tell you my background is as a neuropsychiatrist, which means that I've done a residency in psychiatry, but I've also done a fellowship in behavioral neurology and neuropsychiatry, and I have a PhD background in cognitive neuroscience. So I've always been interested in basically the borderline between neurology and psychiatry. To me, it's just amazing and kind of sad that even in this day and age, we really have two specialties for the same organ, the brain, which is really strange to me because, we don't see that anywhere else in medicine. You don't have two specialists for the heart, for example, or the lungs or something like that. But we do for the brain. And I think it's kind of a historical vestige, and hopefully things are kind of getting together again between neurology and psychiatry. But that was one of the reasons I wanted to write these books, is for the public to understand that really when we talk about the brain, we're looking at neurological, quote unquote, neurological factors, but we're also looking at psychiatric factors. It's the same brain, it's the same organ. And many illnesses and brain injuries lead to both quote unquote neurological and quote unquote psychiatric outcomes or effects. And that was really kind of one of the driving forces for me. And the other driving force was I worked for a number of years at a brain tumor center. And I've seen a lot of patients with traumatic brain injury outside of that as well. And one of the things that always strikes me is that people kind of subconsciously perhaps just automatically assume that if it's something that relates to motor functioning, well, that's quote unquote real. That's because the brain has been damaged or injured. But then if there are problems with mood or behavior, people take that on themselves. They don't understand that also can be due to the injury. And so there's a lot of education that I do when I see patients and I do neuropsychiatric evaluations to really help the patient and the family members especially to understand that damage to neural circuitry, to neural networks can cause mood problems, they can cause behavioral problems, they can cause cognitive problems, what I call neuropsychiatric symptoms in the book, as well as, of course, more traditional things, neurological, such as motor dysfunction and things along those lines.
Excellent. That's a very good summary of that. And I had actually always wondered why neurology seemed to be a completely different department than psychiatric. And I actually have a friend who is uh, he's a psychologist who does both psychiatric and psychological evaluations, but he has worked on developing some, using the tools of the objective neurological tests as well with some helpers. He has them do these different tests on people, and then he kind of summarizes it. But he calls it a neurological psychological exam, which is different.
Yeah.
So that being said, in the book, it's very readable. It's obviously for the public, and you kind of explain the structure of the brain. But I think an interesting point that you were making, because as the book goes on, it talks more and more about, what are these injuries, what types of injuries you can have. But a thing that struck me that I did like is that you spent a great deal of time not only talking about the traditional, what we would, brain injuries, where people think of somebody, losing the ability to move part of their body or something like this, or a memory, right? But very important point is that sometimes it's a behavioral or emotional change in the person. And that is where the family members, I think, really get upset because they get upset both ways, but they can really be upset at the person saying, why are you changing your mood and behavior around us? What the heck is wrong with you? Whereas if they have an arm that's not working, it's obvious like that was from the brain injury. Is that kind of what you were trying to do there?
Yeah, exactly. That's exactly what it is, because it is sort of based on our notion, honestly, of free will and kind of all these philosophical assumptions that we have built in our society. And so, it's interesting, though, it may seem controversial to the general public, but most neuroscientists believe that there's limited free will in the sense that your brain does constrict basically your behavior. Right. So if you have injury to your brain in certain areas of the brain, certain circuits or networks in the brain, you're going to see a certain outcome. You're going to see a certain behavior. You can see a personality change in a certain direction, for example, or you can see a mood problem in a certain direction, such as depression, or you can see mood lability, moods going up and down a lot, or you can see something called pseudobulbar affect, where the person is crying or laughing almost uncontrollably, but yet the mood itself is not actually changed. So the bottom line is that there are different circuits that, if you damage them, they will cause very predictable changes in mood and behavior and cognition. And that's not intuitively obvious, I think, to the lay public, because as you just put it, if someone injures a part of their brain that affects their movement, let's say their left arm, well, I mean, it's obvious to most of us, okay, the person had a stroke, let's say, and they have damage to the part of the brain that controls the left arm. Okay, it's not their fault. It's the stroke. But on the other hand, if you have a person who now changes their behavior after a brain injury, it could be a stroke, the same sort of brain injury, but it's a stroke in a different part of the brain, a different network in the brain. That too can cause a very predictable change in outcome, in this case in behavior, or in terms of mood, or in terms of their thinking or memory. And we don't necessarily think, oh, well, this is the same thing. No, we tend to think of it, oh, well, that's the person. The person has changed. They're doing this on purpose, that there is some willful aspect to it. And that's why I brought up the notion of free will there, is because, of course, there is, we all think we have free will to some degree, but from a neuroscience perspective, if you damage certain circuits in the brain, you're going to have certain changes in your personality, your mood, and your behavior and your cognition. And just as reliably as if you damage another part of your brain, you're going to have a loss of movement in your left arm.
I love that summary. And before I go on to ask you more questions, I want to make a little crossover comment to the world of what we call trauma-informed therapy, but now kind of becoming nervous system-informed psychotherapy and developmental studies, is that I believe the free will argument is also being had in the fact that many people in our field have discovered that due to your environment and your living conditions and your parenting and your culture and your socioeconomic status, these things can all influence a person's behavior and moods and abilities, so much so that the person may not be able to behave like our society or a segment of our society or a family member believes they should be able to behave, right?
Right.
They've actually lost that ability to behave in a certain way. This is a very vague and general thing, obviously. And, but that then as they go through treatment and psychotherapy, they can regain some of these skills that they may have not developed or underdeveloped, and these weren't even caused by a brain injury. This was just the way that they developed was influenced in a way that makes people think that there's something drastically, horribly wrong with this person. And we see that as that's just a developmental side that's showing that how the brain develops can stay in place in a very rigid way or a chaotic way that is very off-putting to other individuals in society. Any comments on that?
Yeah, no, absolutely. That makes perfect sense and kind of fits in exactly what I was saying, because I mean, ultimately the argument would be from a neuroscience point of view is that it's really about the brain and how it changes over time. So there's this notion of neuroplasticity, which is really your brain's ability to change based on experience. Now, the experience could be exactly what you just mentioned. It could be childhood experiences, adverse events in childhood. It could be other environmental factors. It could be a brain injury. That's also an experience to the brain. Any of those things can change these brain circuits, these networks. And once you change those networks, like I said, in a certain way, it is something you can develop. You can develop these other symptoms, these dysfunctions like we just talked about in terms of mood or behavior. And in a very, like I said, in a very predictable way, oftentimes. So the brain is very malleable. It is basically our interface with the world, and so it changes. It changes all the time. Every time we learn something, your brain is changing. It could be something good, it could be something bad, but your brain is going to be changing. And so we can actually utilize that fact and use technologies to actually help the brain change in a positive direction. It could be after, let's say an adverse events in childhood, or it could be after a brain injury, but it would be the same concept.
Yes, absolutely. So I'm glad you helped us understand that more. I think what I'm going to move into, because I was going to ask you some stories of success, but I think to understand the stories of success or stories of difficulty in the medical world with brain injuries and concussions and whatnot, I think we must understand this concept of neuroplasticity, which you go into in much detail in part 2 of the book. Could you maybe explain a little bit of this, what you mean by plastic or neuroplasticity?
Yeah, so this term neuroplasticity is really kind of getting from this idea that, if you have a plastic mold and you put something in that plastic mold, the plastic sort of conforms to fit around it. And you can have different plastic molds depending on what you're putting into the plastic. So you can have a plastic shape A or plastic shape B or plastic shape C, but they're going to look different. And so this is really coming from William James, the famous psychologist and philosopher, and he did everything, it seems, back in the 19th century. And so it's really coming from his ideas that there is this plasticity, which really just kind of means that changeability or malleability. And neuroplasticity is malleability of the brain, so that the brain can actually change. Now, for many years, we used to think in neuroscience that it's really only children where the brains are more flexible, the brains can change a lot, and that's true. But we used to think years ago that there's not much that can happen in adult brains. But now we've discovered over the years that that's not the case. It's true that children's brains are more flexible still, but adult brains are also changeable. And as I mentioned, just in terms of learning, every time as an adult we learn something, our brains are changing, literally physically changing. And so there are ways that we have tools now where we can really enhance neural plasticity. So, this is normal in the adult brain to have this malleability, neural plasticity, but let's try to find ways to actually improve that neural plasticity in certain cases if we have a patient who has a certain dysfunction. So, and there are many ways to do this, by the way. So one of them is called TMS, transcranial magnetic stimulation. That's something I do in clinic myself a lot. So TMS, just to briefly describe it, it's basically using magnetic pulses, brief magnetic pulses, that we then basically allow the magnetic field to change across the scalp, and it goes right into the brain. And that induces change in neuronal firing. So the neurons are firing at a different rate, they're excited or they're inhibited, but they're changing. And so with TMS, we can do this in a repetitive fashion where we're pulsing, we're having these magnetic pulses on the head, and they allow over time, they allow the underlying neural circuitry to change. That's neuroplasticity. We're actually changing or modulating or molding, if you will, the neural circuitry that we're affecting with the magnetic pulses. And we can do this in a way that enhances clinical outcomes. So, for example, in people with chronic treatment-resistant depression, and this is where the FDA has cleared TMS, for patients who have that problem, we actually stimulate the left side of the dorsolateral prefrontal cortex, the front part of the brain. We stimulate this over time. It's multiple sessions over multiple days and weeks, but we stimulate it over and over again, that part of the brain. Ultimately, what's happening is that the brain is changing from that stimulation so that this part of the brain has better connections to more of the emotional brain deep inside. And so this frontal lobe, this part of the frontal lobe can better kind of modulate our emotions so that people can kind of get out of that hole of depression that they're in. So we can do this with other things. We can do the OCD, obsessive compulsive disorder, different target, but same concept. Also with smoking cessation, people who have chronic smokers, that's also something we can use TMS for to improve that addiction. So there are many, many uses. You can think of TMS kind of like a platform. And once we know the neural networks that are involved, we can target different parts of those networks and actually change them, modulate them, enhance neural plasticity. So that's a very exciting, I think, area of all of this. I think that, there are lots of studies that are ongoing for lots of different conditions. But right now we have these three FDA clearances for TMS. It's major depression, OCD, and smoking cessation. In the future, hopefully we'll have others, including mild cognitive impairment or early Alzheimer's and all kinds of things like that. So I think that's the future because we medications have a role, of course, therapy has a role. All of those things are also affecting the brain, obviously. But what I like about neuromodulation techniques like TMS is that we're directly using our understanding of neuroscience and we're directly impacting those circuits that are dysfunctional, and we can actually improve the functioning of those circuits. And there are other ways. TMS is just one way. I also do research with digital therapeutics, which is basically game playing for the brain. There's actually an FDA-approved, FDA-cleared video game now for ADHD in children as well as adults now. And so this game was basically designed in such a way that it actually improves the functioning of certain circuits in your brain that are dysfunctional in ADHD. And again, just like in TMS, with TMS, you have to do it repetitively. So you have to play this game, say 20, 30 minutes a day, a certain number of days a week, et cetera, for a certain amount of time. It's just like training for a marathon or training in some way physically. It's the same thing with your brain. You have to train it. So you've got to do it over and over again. Same thing with TMS. You have to do it on a daily basis for, say, 6 weeks. But the bottom line is that all of these different technologies and techniques are ultimately enhancing neural plasticity, which we need when a person has a brain injury or has some sort of a neuropsychiatric disorder that we want to improve.
Excellent summary. Yes, TMS is obviously some of the cutting edge. And the thing I like about TMS from what I've read so far is just that, like you said, it's actually by targeting those specific areas, you're trying to get the brain's and the body's natural kind of like what I guess the natural healing or the natural integration to
connectivity.
Connectivity. Thank you.
Yeah,
connectivity.
Exactly.
Thank you. That's a better way of putting it.
Yeah.
To actually work itself versus when like you said, medications and therapy have a role, but that's the external, coming in. Where this is like the external magnetic is really going right for the internal connectivity parts.
Yeah.
So like all these things can alter the brain, obviously, in various ways, to enhance what we're looking for. So I was curious about some. I want to get to the technical parts for our audience, but I want to kind of give them a little flavor of maybe some stories of success you had treating, let's just say, some type of brain injury. Could you share one of those?
Sure. Yeah. As I said, I've worked in a brain tumor clinic for a number of years, and What's really, I think, fascinating with brain tumors is that, I mean, there's clearly something wrong. You can see it on the MRI. So you know that there's an overt brain injury, which is not the case with a lot of things. Like with, we don't have that with, lots of other illnesses. But with brain tumors, that's one good thing is we can see it, right? But, once you do surgery, you do, treatment, chemotherapy, et cetera, oftentimes people are left with these neuropsychiatric symptoms and unfortunately, a lot of times patients don't really understand that it's due to the brain tumor, or the families don't understand. And that was really one of the things that I really enjoyed with this patient population, is to really help them understand that connection. So I'll give you an example of a case. I had a patient who had a brain tumor deep within the brain, actually. Well, I won't say it's deep within the brain, but it was in the insula, which is basically, if you kind of think of the brain like this is the front part of the brain. This is the temporal lobe. The insula is right between, essentially. It's kind of hidden. It's called the hidden lobe of the brain. And so she had a tumor there. She had resection of the tumor. She had chemotherapy. She had actually done quite well from just sort of the overt oncology point of view. But she had this very deep depression that was there. That was a very kind of very big problem for her. Ultimately, that was the biggest issue for her, more than anything else, was this depression. And it was kind of it was anhedonic depression. It was basically she was not able to enjoy anything. That was really the biggest problem for her, and it made a big difference in her day-to-day life, her relationships with her husband, and so forth. And so that, once you know, though, the neuroscience behind this, I mean, you understand that the insula actually plays a big role in terms of mood regulation. It's important in what's called the salience network, which is important in terms of the brain knowing what's important, what's not important. So there are all these networks in the brain that have all kinds of roles. But in this field, in terms of neuropsychiatry, we find that the salience network, the cognitive control network, and the default mode network, those are big three networks in the brain that, if you have damage to them, you can cause all kinds of neuropsychiatric symptoms. And so that was an example of a patient where really understanding, okay, what the insula is playing an important role in mood and in anxiety and so forth, allowed me to really kind of target that in a different way than I would have normally done. So if it was just a patient who came in with depression, we have an algorithm we typically use in terms of medications and so forth. But in her case, I was able to actually really get at the anhedonia. And there are certain medications that I use that were really specific to anhedonia, which ultimately were able to help her and improve her symptoms. So I think that's a great example maybe of where you can kind of look at it from a neurology side, you look at it from a psychiatry side, and you really realize it's all about the networks. It's all about the neural networks and how can we modulate those neural networks. Sometimes you can do it with medications because, dopamine plays an important role in terms of anhedonia in that part of the brain. And so I use a medication to help with that, increasing dopamine in that part of the brain, and that helped her. So that's just an example. But, in the traumatic brain injury world, I've seen lots of patients who, for example, will have personality changes due to a frontal lobe injury. And this is very classic, actually. And I write about it in the book. But Phineas Gage is the person that everyone always talks about if it's anything related to neuroscience, oftentimes. So Phineas Gage, just for the audience, he was a railroad worker in the 1800s who had an accident. He had a tamping rod that actually hit from right above his eyes. The orbitofrontal cortex actually came out on the other side. The surgeons were able to, kind of remove it. He actually did fine from a physical point of view, from a quote unquote neurological point of view. He was, seemed normal. But what people started to realize is that his personality had changed tremendously. Before, he was this very conscientious person, made sure he was everywhere on time, got his work done. And then after this accident, he was a completely different person. The famous quote is, Gage was no longer Gage. He became much more disinhibited, impulsive, not conscientious, almost sociopathic. And so that's an example of where you damage the certain part of the brain, you're going to have all of these changes in behavior and personality. So it's not like Phineas Gage was trying to do this on purpose. He was not trying to be this way. he couldn't help it because that part of his brain was damaged. And so I do see a lot of that where people, especially with orbitofrontal cortex damage, just like Phineas Gage, people can have a lot of impulsivity and disinhibition. And there are medications we use to sort of focus on that aspect of things, lower the impulsivity.
Excellent. Yes, that is a very good story. I remember that from psychology school, where I went to a graduate school. But and there's many types of brain injuries that can cause so many things. Obviously, this is why I tell people always wear a bike helmet if you're riding a bike or a scooter. Now we have scooters in all the major cities that you can rent on your phone. Wear a helmet. But I was looking at the types of brain damage. I didn't even know all these existed. But we have a contusion, which is the bruising of the brain, which is more of like is that what would cause a concussion, or is that beyond a concussion?
You can have a concussion. It's kind of a general term for a mild traumatic brain injury. A contusion is actually more overt than just a concussion, but those are kind of orthogonal terms. One is really in terms of severity. So a concussion is a mild brain injury, traumatic brain injury. You can have a moderate traumatic brain injury. You can have a severe traumatic brain injury. But then you can have different causes of those brain injuries. And contusion is one mechanism by which you get a brain injury.
The bruising, right.
Yeah.
There's a lot of scary things in here, like breaking the skull, like an epidural, collection of blood between the skull and the thin outer layer of the brain called the dura mater, the subdural. So it's just like, and then the bleeding in the brain, this intracerebral, anoxic, which is the lack of oxygen or decreased oxygen to the brain, which we've found with people who are almost drowning or things like that.
Right.
Diffuse, I didn't even know about, which is injury to the white matter fibers of the brain. But it's suffice to say, the brain is a very resilient organ, and a very malleable organ, but also very delicate and important to get in if you've had any sort of head injury in any sort of way. But I think most people can understand that lack of oxygen can cause parts of the brain to literally die off, right?
Yes.
I mean, am I right about that?
That's right.
And then brain blood, forming in different parts of the skull or between different layers can cause pressure, and the pressure can cause major damage to different regions, which can then cause damage to speech, motor function, memory, all these things, Am I right about that? Okay.
Right.
And then, but what is this diffuse? What is that? The damage to the white matter? I don't even know what that is.
Sure. So there's something called diffuse axonal injury, or DAI. It's basically, if you think about the way the brain works, I mean, you've got neurons, and then you've got white matter tracks that connect the neurons.
Right.
And so you can have let's say a whiplash type of an injury. You're in a car, the car stops suddenly, your head moves suddenly forwards, and then it goes back suddenly.
Yes.
That could actually stretch those fibers, those white matter fibers. And so even though you may not have a kind of obvious brain injury, your standard MRI would actually be normal. But you may actually have tearing or stretching, at least, of those fibers, the white matter fibers. And if you have that, there's a very common pattern that we see in terms of cognition. People oftentimes are slower in their thinking afterwards. They oftentimes, their processing speed goes down. They may have more mood changes towards depression. I mean, there are all kinds of things that we can oftentimes see with that. There are some types of scans that can maybe pick up that. So use like diffuse tensor imaging, DTI, MRI, and that can show some of the damage. But those are much more subtle. It's much more subtle damage. But that is also a kind of brain injury, and it's important to not, ignore any type of situation like that. Even if your head wasn't directly hit, and we typically think of a traumatic brain injury when your head is hitting something or something hits your head. In this case, you may not even hit your head, actually, but it's just the sudden movements of your brain within your skull that can cause the tearing. And as you said, the brain is, it's malleable, but it's delicate. You're exactly right about that. Because, if you think about it, your skull, of course, is very hard. It's a protective case around your brain. Your brain has the consistency of Jell-O. It's a gelatinous material. And there are sharp ridges with your skull, especially in the front part of your brain, and the side part of your, front part and side parts of your skull. So there are these bony ridges. And so if you have your brain jostling inside the skull, the actual bony ridges can cause damage to the brain. So it's really unfortunate in many ways that the front and the side, the frontal lobes and the temporal lobes, those are very common areas of brain injury for that reason, because you've got the soft material sort of jostling with this hard material, the skull. And those parts of the brain are critical for mood, behavior, and cognition. So we see a lot of these problems in people who have brain injuries to the front or the temporal lobes, frontal or temporal lobes. And that's not uncommon at all after car accidents or other things like that.
And it's interesting you said it's unfortunate the brain is formed that way, but I wonder if that was just because evolutionarily we really weren't going over 20 miles an hour until about, I don't know, when the locomotive was invented or something like that, right?
Right.
A couple hundred years ago.
Yeah.
And so then I wonder about people that are into these sort of like thrill-seeking sports, like riding these dirt bikes and NASCAR drivers and these people that are going hundreds of miles an hour, and these maybe they never got in a collision, but I wonder if the jostling itself. I wonder if you've ever seen an injury from that or issues.
Yeah, no, I mean it definitely can occur, especially if it's repetitive, right? It's really. I mean, certainly one or two type of things like that may not be so much, but if you keep on doing it over time, then absolutely that can cause problems in terms of these subtle findings. And again, it may not be obvious on a standard MRI, but people may have all sorts of more kind of generic symptoms. They feel like they're slower in their thinking, their mood is off. Could be they have some balance problems. So it can be much more subtle than sort of the obvious, okay, I have this big, rod in my head. It may be very subtle. But yes, that's absolutely true. And we also have to be careful, I mean, over time, about the risk of dementia. Not necessarily with just this, but I mean, for example, there is something called dementia pugilistica, which is really based on boxing. If your head is hit multiple times, even if you weren't knocked unconscious or anything like that, but like in terms of boxers, they get hit a lot, right? And they're moving their head a lot, and they're jostling the brain inside their skull a lot. Over time, at least in some people, they may develop a type of dementia. There's also this, it's not entirely clear yet, but we do know that from data from pathology, actually, for NFL players and people who get a lot of head hits or at least jostling of the head. Again, if you do this over and over and over again, there's some percentage of people who will develop a sort of dementia with this. So it is, as you said, it's critical to wear helmets. It's critical to protect your head as best you can, and try to minimize the number of times your head is hit or the time that you have, huge movements of your head where you're, like in a whiplash type of situation or whatever it may be, or a sports situation or, extreme sports, as you mentioned. And not that you can't do any of those things, but it's just important to be aware so that you minimize your risks.
I'm glad you said that. I was actually going to bring up the NFL because if you're just a person in the public who hasn't heard of this, even though the NFL players wear these helmets, they still have a lot of hits to their head, and they're trying to improve the helmets actually in the last couple of years. Right. If you just look up on the internet stories of NFL players, behavioral changes in older age, including massive behavioral changes and even suicides and dementias, they're all over the place, especially with players who played in the 80s and 90s now and in the 70s, 1970s. So I wanted to talk about a positive thing for a second, which was one of your tables in here, which was in the recovery from brain injury section, strategies to enhance neuroplasticity. And this seems like possibly common sense, but actually I like that you wrote it and the other doctor wrote this in the book, because it's the funniest things that these little things sometimes are things we want to push off and go, oh, I don't need to do that. Right.
Yeah.
But number one, exercising regularly. Could you elucidate a little bit what you mean by that?
Sure. So exercise is really sort of a miracle drug, so to speak. I mean, it seems to help everything. But I mean, it is true that what's good for your heart is good for your brain. Because there's a commonality there. I mean, obviously, blood flow, right? So your brain works on blood flow. And one thing which is not commonly known is that your brain is approximately 2 to 5% of the body mass, but it actually consumes about 20% of your energy. So it's a huge energy hog. it really needs a good flow, good blood flow. And why it needs good blood flow is because, of course, oxygen is with the blood, right? So you want to oxygenate the brain well. And so exercise is good for your brain because it's good for the rest of your body. It's good for your heart. So as you exercise, you develop less resistance, arterial resistance. Your blood flow is smoother and it can diffuse into the brain better. And you have a higher oxygen sort of utilization of the brain. So that's the main thing. The second kind of exercise is cognitive exercise, so brain training. And that's what I was referring to before in terms of like video games for ADHD, those sorts of things that are now have been developed. Those are ways to really train your brain so that if it's like, again, like a muscle in a sense, the more you use the muscle, the stronger it'll be. So same way, the more you use your brain, the better it'll be. And there'll be more what we call cognitive reserve. So we do know this, that in people who have brain injuries or have some other something happen to their head and brain, they tend to have less symptoms if they have more reserve, meaning that they have, over the years, they've had, let's say, more learning, more education, they are better physically in terms of fitness. All of those things can kind of cushion your brain to adverse consequences from a brain injury, at least to some extent. And it can help in terms of resolution of the brain injury symptoms. In terms of the dementia literature, in some cases, it may actually delay the manifestation of the dementia. I mean, it doesn't prevent the dementia, but it could delay the manifestation to the point where it becomes less and less of a problem as people get, as they get older, you have a higher risk of getting dementia anyway, but you can push it off in later years, even so more if you have a good cognitive reserve. So anyway, these are just different examples of how really helping your brain by physical fitness as well as by cognitive fitness can be really good for your brain health overall.
And that's interesting that you said the cognitive part. I was hoping you were going to mention that, but I also want to hear your opinion. Here we go. About reading books or listening to audiobooks or podcasts for information. What is your opinion? Now, I know that reading the news can cause stress, right? Yeah. If I pull up the newspaper, which on my phone now, the New York Times, and I'm like, oh, I really want to know stuff about the world. I'm like, oh, geez, now I'm all stressed out. But let's just say a novel or a self-help book or a science book or reading these books or just listening to audiobooks and podcasts. What are your opinion about that? Maybe more neutral material.
Yeah, no, I in my opinion, I think the more you enhance the learning process in your brain, the better it is. So yes, I think reading a book, a podcast, whatever it may be, I think it's going to be, it's really good for you. It's really good for your brain. As you said, as long as it's a relatively neutral thing, it's not something that's going to, agitate you and make things worse. But in general, it's good. I mean, I think it's not controversial to say that some of the sort of highest functioning people in our society, they don't hide the fact that they read tons and tons of books. It's great if you have a stack of books on your nightstand that you're going through. I think that has many benefits. I mean, obviously there's the sensory aspect of it. There's the motor aspect of when you're opening a book, especially. But then, of course, there is the whole experience that you have in your brain when you read a book. You have imagination that you use. You have you can kind of place yourself in the character's position, which is actually really good as well. You can help you naturally sort of predict what's going to happen later on, which is an important part of really what the brain does. That one of the key things that the brain does is try to predict the future to minimize harm for your body. And so by reading and imagining and sort of thinking through all of these things, it can actually help in terms of what the brain is designed to do ultimately. So it increases, I think, efficiency of brain processes. The faster you read, also, the more you read, the faster you read, and the faster you read, it basically helps you in processing speed, which is good for everything you do. So I really don't see a downside to any of this. I think if you can do it, I would highly encourage you to do so.
Excellent. I want to talk about some of these other strategies because there's so much in this book about people that have brain injuries and what happens and how they recover and all of these things. But honestly, I feel like an hour time we have together is way too small of a time to discuss those. And I actually would just encourage people to buy the book if they know anyone in their life who has a brain injury or has had one in the past, or if they've had one. It's so important because I feel like Like this book is something that you should be reading in college, because when I was reading college textbooks, they were so complicated that I would get really bored. But I was not bored when I was reading this book because it was summarized so well. I want to talk just for our listeners, give them a little, it's kind of like a little sample, right? Podcasts are a little sample. I want to give them a little sample of some other strategies to enhance their own neuroplasticity. So maybe they didn't have a brain injury, right? They just want to enhance it. This is an interesting one. It seems obvious to me, but I don't think it's really obvious to most of the public, which is eating a healthy diet of fruits, vegetables, whole grains, proteins, and hydrating adequately, which you mean water, not just Gatorade or alcohol or coffee. So I'm assuming. So can you just say a little bit about why that's important?
Yeah. Yeah. So we're learning more and more about the brain gut connection. And this is something, at one point was controversial, but I think as we're learning more and more about how the body works, we're understanding that there is very much this connection between the brain and the gut. In fact, there is an enteric nervous system. There's a whole nervous system, basically a secondary brain in your gut. Which of course is separate from your primary brain in your skull. So there are a lot of neurons, and not just neurons, even non-neuronal cells like called glia, which are in your brain but are also in your gut. And there are a lot of studies now that indicate that what happens in your gut affects what is going on in your brain. So there's this bidirectional kind of a relationship between your gut and your brain. So as just kind of put it in a simple way, really, it's that you've got a certain cohort of bacteria in your gut. I mean, one of the things which always fascinates me when I talk about this is that you have more non-human cells in your body than human cells. I mean, just think about that. That's amazing. It's just mind-blowing. We think of ourselves, I mean, of course, this is me. I'm a human. I have all these human cells. But we're outnumbered, terribly outnumbered by non-human cells, which includes bacteria primarily, but other types of animal cells as well. So it's something that, if we think about this, our body is really more of an ecosystem. It's not just this is my body. There's a whole ecosystem, just like in the environment. There's an ecosystem, and you want to have a balanced ecosystem. You don't want to have an ecosystem where you have some particular bacteria or animal just ravaging the rest of the ecosystem. You don't want that. And so similarly, when we talk about our gut, we want to have good bacteria as opposed to bad bacteria. I mean, that's all relative, but in generally, we want bacteria that are good for us to be predominant, not bacteria that are more parasitic, that can cause problems for us. And how do we do that? Well, nutrition is really the key way. Ultimately, it's your gut, right? So that's your digestive system. So what you eat makes a big difference in terms of the bacteria that you have in your gut. And you want to encourage that good bacteria. And the bacteria in your gut, believe it or not, can actually affect neurotransmitters in your brain. So there are data to suggest that serotonin, for example, which is an important neurotransmitter for mood in the brain, there are bacteria in your gut that can actually impact serotonin and impact what goes on in your brain in terms of mood. So this is, I mean, to me, it's really fascinating. It's kind of common sense in some ways, but it's also, the science is now really developing, I think, to suggest that we really should be focusing on our gut a lot more than we traditionally have. And I like to use the term, the standard American diet is the SAD diet, SAD. It makes you sad. You don't want to be eating processed foods all the time. You don't want to eat fast food all the time. You really want to, as we talk about in the book, you really want to have green vegetables. You want to have leafy greens. You want to have fruits. You want to have colorful, as we say, this color diet, which is, having a lot of colorful fruits and vegetables are really important. Water, of course, is really important. 70% of our body approximately is water. So we want to make sure that we have adequate hydration, adequate water in our body. And these things, I mean, yes, they're common sense. We all kind of know it, but there's a difference between knowing it and doing it. Right. And so hopefully, if people understand how important these things are, these common sense maybe things, how important they are for brain health, they will really start implementing them more. It doesn't mean you have to do this all the time. I mean, no one's going to be perfect on all of these things, but just making one or two changes in your habits and just sticking to them, I think, is much more important than, doing 100 things at one time or 10 things at one time, because you're not likely to be able to continue doing that.
Yes, very important piece of information. And actually, I was reading a book called Fiber Fueled by some doctor. I can't remember what it's called, but he was talking about how the American diet has the standard American diet has an unfortunate lack of fiber,
Yes.
which can then cause this inflammation in the gut, which then can cause the bad bacteria, which then can cause lack of serotonin and all other types of issues that you were alluding to. I'm going to go through these other ones a little bit quickly because they've been talked about ad nauseum, which are quitting tobacco and street drugs and reducing or eliminating alcohol. This may not seem obvious, but these things all affect the brain incredibly. For instance, not only is it, we've had all these anti-smoking campaigns in the U.S., but it's not only that the smoke can cause damage to the cardiovascular system, which can then affect the brain. I also found out that nicotine apparently constricts blood vessels, which I did not know, because some people say, oh, just you can vape or use a nicotine patch. Well, nicotine is also horrible for our brains and our cardiovascular system. Alcohol, of course, our body views it as poison. Is that correct? It sees it as a poison that we have to get rid of it. And then the effect we get from the alcohol, which is, the depression in the nervous system to kind of relax us or take away our inhibitions, is coming from our body eliminating the poison. And then, of course, the hangover is created by the chemical acetylcholine, which I believe the liver makes it as a byproduct or something like that. So these things, to enhance neuroplasticity, these are your tips. Also engaging in hobbies, because you said here, as the writer Will Durant wrote, paraphrasing Aristotle, we are what we repeatedly do. Practicing tasks and repeating activities can help with rewiring the brains. Similarly, it is possible that enriching our lives with novelty, creativity, and challenges can promote neuroplasticities. And I saw a direct link with that in your advice here to engage in hobbies, and also staying active by learning new tasks as long as they are pleasurable, which could be, something like learning to kayak or, or learning to juggle or use a yo-yo or play an instrument or something, just something interesting, something active versus the passive consumption of media, which is television, internet, where you aren't really learning, you're just sort of numbing your emotions. Is that a decent summary of those?
It is. And just to add to that, what I would say, this is something I tell my patients all the time, is one of the easiest things you can do in terms of learning something new is use your other hand more. If you're right-handed, start using your left hand more. Try to do more things with your left hand, or vice versa. Because, over time, if you do that over and over again, you're gonna rewire your brain. Your brain is gonna change just from that simple act of using your non-dominant hand more.
That's wonderful. Two last ones that I want to hit on before we go into a little bit more about the brain injury and wrap up is the practicing relaxation and self-care. And you wrote such as yoga and meditation. And there are immense studies and a stack of books that are on my shelves about how mindfulness meditation, which is the most simple thing to ever learn to do, apparently increases gray matter in the brain. Could you tell us a little bit about why that's important?
Yeah, absolutely. So meditation, such as mindfulness, as you mentioned, I mean, it's really, as you said, it's simple, but the key is, again, kind of making it a practice, making it a daily part of your routine. Another little phrase I like to use is that just like you have dental hygiene, you have mental hygiene. So like you brush your teeth every day. You don't really think about it, most people anyway. You just do it. It's a habit. Similarly, you want to have a habit of mental hygiene. So some sort of a practice, a stress management practice, such as mindfulness or other meditation, yoga practices. I think it's absolutely critical, not just for people with brain injury, but really for everyone in our modern day in society. We have a chronic stress problem, and chronic stress in society affects us. It affects our brain. And so our brains are not going to be as efficient. Your mood is not going to be as good. Our cognition is not going to be as good. Our attention is not going to be as good. I think we're seeing that already. There's skyrocketing rates of problems like this in our society, and part of it is because of chronic stress and the fact that we don't have a good way necessarily of managing our stress, our daily stress. It's not necessarily just the big events in life that can cause these problems. We're talking about daily small stressors, but consistent stressors. So similarly, I think it's really important to have some sort of a daily consistent practice that sort of mitigates these daily stressors that we have that build up over time. So mindfulness is a good one. As you said, there are tons of books on it. There are tons of apps. There are all kinds of ways you can learn about mindfulness. It's really, to me, mindfulness is all about essentially kind of allowing yourself to be more observant. You could be more observant of your thoughts without reacting to them necessarily, or more observant about your body, about your breathing especially. Those are very common ways to kind of ground yourself in the present moment. So that can be helpful. And I talk about in the book also some specific other meditation techniques one is called TM, Transcendental Meditation, and the other is called Sky, Sudarshan Kriya Yoga. Let me talk about them really briefly here. So Transcendental Meditation, or TM, is actually a very well-validated meditation technique. Lots of studies that are, and in fact, I just published a paper in the Journal of American Medical Association Network Open, where we did a study of transcendental meditation for physicians and healthcare workers for burnout, to mitigate burnout, which is a big problem in the healthcare world, actually. And we showed that there's a significant improvement in burnout, in chronic stress, and those kinds of things in this group. So TM it's different than mindfulness. It's actually, in a way, in a sense, very different, because there you're learning a mantra, a phrase, and you use that phrase to essentially get to the point where you have very little thoughts. You sort of transcend the mantra to the point where you have very few thoughts. And so it's kind of you're emptying your brain in a sense, and having much less thoughts, and it can be a very pleasurable experience. It is something that you have to go through. There's a group that does, the organization that teaches it, called the TM group, Transcendental Meditation. So you have to go through them, but it's something that there's a lot of data for. And then the other thing I was going to mention is Sky, Sudarshan Kriya Yoga. It's a kind of rhythmic breathing yoga. You breathe in certain patterns. And that's also been well studied. In fact, I just did a study. I'm soon going to hopefully publish a paper on this. But we did a study where we looked at, again, burnout in clinicians, using where we taught them this method to reduce their basically sympathetic nervous system activity. It's basically a way to decrease the fight or flight system. And it's not just for this population. It's really for anyone when they feel stressed. It can be something very beneficial. So those are just mindfulness, as you mentioned, TM and Sky, and there are lots of other different practices which may have less data for them. But all of these things, I think, are good. Whatever works for you, it doesn't matter so much, I think, to choose one that works for you, and then you keep doing it. I think that's really the bottom line message.
That's excellent. Yes, I actually have practiced TM myself. And I found it very useful, actually almost more useful than mindfulness meditation, because of the active nature of it. My brain is very busy. And so I found that the active nature really fit with me versus the mindfulness meditation. I ended up just like sitting here every time I did mindfulness and writing down a list of tasks that were in my brain. Right. So TM, actually, I kind of forgot what I was doing, which is an excellent way to do it. So it's you can definitely get training in that through the TM Institute, I believe it's called. The last one, practicing sleep hygiene. I mean, I could have a whole podcast on sleep, but not only sleep hygiene, which you go into detail here, but I have been curious not only about how sleep affects the brain, but sleep apnea, because we do have an obesity epidemic going on, and I believe that can cause obstructive sleep apnea. Could you tell us a little bit about how apnea or sleep issues can affect the brain?
Yes. Sleep is absolutely critical for the brain, as you said. I mean, we spend about a third of our lives sleeping. So you can imagine that there must be a really good physiological reason that we're designed to do that, right? So if we're not sleeping well, meaning that either we're just not sleeping enough or the quality of sleep is not very good, either of those or both of those can absolutely affect brain functioning. And kind of the obvious part is, of course, you're more fatigued, you're less efficient. But some things which are not so obvious are that you can have ADHD-like symptoms if you have sleep apnea, for example. So sleep apnea is really where you're not getting proper oxygenation to the brain. And we know that with people who may be more obese, if they have a thicker neck, especially, they can have more constriction, airway constriction, and that's what sleep apnea is, where you have this very loud snoring, but not just that, but you're gasping for air at night because you have this constriction in your throat. So that's an obstructive sleep apnea. And so for folks who have that, I've definitely encouraged them to get a sleep study. That's really the way to know if you actually have sleep apnea or not. The good thing about sleep apnea is it's very treatable. I mean, you can use a CPAP machine. There are other technologies that are available now. But any of those things can help kind of increase the airway diameter, so you don't have that resistance in your airway. You get more oxygen to your brain. And we do know in people who have sleep apnea, they're at risk for all kinds of things, actually. So they can have more mood problems. There's more depression. They can have ADHD-like symptoms. Also, it's not good for your cardiovascular health either, because it's putting more strain on your heart, because your heart has to compensate for this lack of oxygenation that's going on. So it can cause cardiac problems. So there are all kinds of things that can occur if that's not treated. So sleep is definitely one of the main things. I talk about this with my patients all the time. I mean, it's really important to sleep adequately. I think in our society, oftentimes we kind of think that, well, we should be busy, we should be spending every hour doing something, and we should not really be resting so much. But actually, as it turns out, that's exactly the wrong way to go. I mean, of course, you want to be efficient in your work, and to be efficient in your work, you really need to make sure that you sleep adequately, sleep well. And it's not a luxury. I mean, I think people still sometimes think of it as a luxury. It's not a luxury. It's as important as food, drink, everything else that we do that is necessary for our body. Sleep is just as necessary.
I love that you said that. There was this old adage that teachers used to say when I was in elementary school, and they'd say, "The night before a big test, don't worry about studying. Make sure you get enough sleep." And I thought, that sounds like a folk tale. And then, of course, when I got into psychology, I learned that that was actually completely true, and that you would perform better with a more rested mind. I know we're almost running out of time, but I want to just tell the public here. This book, not only goes over the traumatized brain, how that occurs, but it has a lot of solutions. Obviously, you say this is not a substitute for medical treatment. Please see a doctor. But it goes over also emotional. I like how you divided these up. Emotional problems caused by the brain, of course, depression, mania, anxiety, PTSD, things like that. Other issues, behavioral disorders caused by the traumatized brain, and oftentimes we get these things mixed up with some of the other things I just mentioned. But this psychosis, which is a break from reality and different symptoms there, aggression, impulsivity, substance use disorders, apathy, sleep disturbances. I honestly think that this is important for parents out there who maybe have had a child who isn't necessarily, maybe they haven't had a brain injury, maybe they have, maybe they've had a concussion, or like you just said, inadequate sleep. We have to look at what the obstacles to functioning are, and what are these obstacles. And that's why you've got to see a doctor / psychologist / neurologist, depending on the situation and what the issue is, because oftentimes by fixing one of these barriers, working on one of the simple things you talked about with neuroplasticity, especially children can really rebound faster than adults. So it's important to find out what is the root cause of the dysfunction, or causes, I suppose. And then in part 5, you discuss cognitive issues caused by the traumatized brain. And I just love how you and your other colleague divided these, because, in my world as the therapist, we're always looking at the DSM-5 TR, which is a useful yet annoying book.
Yes.
Because it's not really, it's more for us to understand our kind of framework. It's not necessarily as good for helping people, I suppose. But the cognitive issues are very interesting, because I think often those are misdiagnosed, right? They go to doctor, and then all of a sudden, finally, they end up at a neurologist or your office or something, and then you have to run all these tests to see what's going on with memory and executive functioning and these sort of things. And then, goodness gracious, this is another scary part, which was the brain injury problems that are from a traumatized brain going into like headaches and seizures and visual problems and balance issues and hormonal issues that I think are very important for the public to know about. And considering that this book is not very expensive, I do think it's a good investment, because like you said, you could put it on your nightstand. This is a nightstand book. It's not a heavy textbook. It weighs about a half a pound, maybe. At that. So, my audience is a lot of clinicians, but also a lot of the public. And I'm sure that this book can help them. Is there anything out there you would want to say to, consumers who either have people in their lives with brain injuries or anything like that about how to get help if they're not sure what to do?
I think that ultimately, in my opinion, brain wellness is really critical for our quality of life, right? So if our brain is not functioning properly or optimally, then we're going to have a lot of problems in our life. And it could be that's because of an overt brain injury, as we just talked about. It could be, as we talked at the beginning of the show, environmental factors that have affected how the brain developed, any of those things. But ultimately, the good news is that there are methods that we have now where we can actually, very practical methods that can help us kind of get the brain as much as possible back into order. And so I think it is, these are the things where education, I think, is really key. I mean, because a lot of times people don't understand yet, the public may not understand yet, that we do have a lot of behavioral techniques, which, we describe in the book. We have a lot of new technologies as well, like we talked about with TMS and things along those lines. There's a whole genre of things that can be done. But of course, if you don't know that these things are treatable, then of course you're not going to get them treated. So I think, the way kind of to summarize all of this, in my mind at least, is that really the brain is a network, right? It has all of these different networks, these circuits. You damage the certain networks or circuits, whatever the cause may be, whether it's directly a traumatic brain injury, whether it's something related to a developmental disorder, whether it's related to environmental factors like trauma, psychological trauma, PTSD, they all affect the brain. They all affect these networks. And ultimately, we can treat really a kind of a whole wide variety of these problems as long as we kind of focus on the networks that are dysfunctional and we treat those networks. And you can do that not just with medications, we can do that with behavioral changes, which we focus a lot in this book, because it's not always about medications necessarily. It is about how you yourself can change your behavior. So I would encourage people to, if they have a loved one who had a traumatic brain injury or other brain injury, you definitely obviously are going to treat what is overt, but don't neglect the other aspects. Don't neglect the behavioral changes that may occur, or the mood changes, or the attention problems, or the memory problems, or problems with multitasking or problem solving. Any of those things can occur due to a brain injury, and there are ways that we have now to address those symptoms.
Great. I think that's great advice for everyone out there. And I'm very happy to have interviewed you. It's been an honor and a pleasure.
Well, thank you. I've enjoyed it. Yeah, I enjoyed it as well. Thank you so much.
So yes, people out there, I will have all of the contact information about how to get this book and how to learn more about Dr. Vaishnavi, and Dr. Rao in the show notes. And thank you so much for tuning in. And there you have it. This has been another episode of the Intentional Clinician Podcast. If you're enjoying this show, please share it with people you know. I would surely appreciate it. Or take just a minute to give us a rating on iTunes. As most of you know, I am passionate about preventing future violence in the United States. My colleagues and I have started a nonprofit called the National Violence Prevention Hotline, a 501c3 organization. We are endeavoring to gain funding and collaborators so that we can start a 24/7 hotline and chat line to reach potential perpetrators before they act violently. It is a bold effort to save lives and curb violence by working to connect with potential offenders while they are in the planning stages of violence, help to de-escalate them, and provide resources so that they can get appropriate professional help. The National Violence Prevention Hotline is looking to open up a conversation about violence in society, the causes, and the solutions. You can learn more by visiting our website, www.violencepreventionhotline.org. Join us online by signing our petition on the website, sharing the website with your network of people, donating to the cause if you like, and you can now even write your congressperson from our website with a simple form. I've said it before and I'll say it again. If you are a therapist looking for ethical and excellent medical billing services, check out therapistbillingservicesllc.com. That's www.therapistbillingservicesllc.com. Billing services created by therapists for therapists. If you're looking for an EMDR International Association consultant, I am a consultant and I can provide you the 20 hours you need to become EMDRIA certified. I have groups online and in person, and I do individual consultation. Just send me a message at the website and I'll get back to you. If you want to get trained in EMDR therapy, check out the great training opportunities with EMDR Training Solutions. I've worked with them before and they are phenomenal, so register today. If you are in need of counseling, do not hesitate to make an appointment at a local counseling center in your area. You can also make an appointment with the excellent clinicians in the Grand Rapids, Michigan area at Health for Life Counseling and the Trauma Informed Counseling Center of Grand Rapids by visiting www.healthforlifegr.com. The recording you just listened to consists of the personal opinions of Paul Krauss and his guest, and while these are based on the literature they have read and the experience in their fields, this should not be viewed as a definitive opinion on any subject. Listening to this podcast is not a substitute for treatment. If you're in a crisis, please dial 911 or the National Suicide Prevention Lifeline at 988. You can also text 741-741 and a live trained crisis counselor will respond. Did you know you could support your local bookstore by shopping at www.bookshop.org? You can order from the comfort of your own home online while supporting local brick and mortar businesses near you. If you are a therapist and you are not a member of your national or local therapy organizations such as the American Counseling Association or the American Mental Health Counselors Association, please get involved, at least pay the dues. It will help the lobbyists in our field keep us from becoming gig workers. And of course, there's the bonus of increasing mental health education around the United States and helping people understand what counseling is and promoting best practices within our profession. Until next time, I wish you all a safe and peaceful week.